The government of Ghana identified the health sector as a top priority under the Ghana Shared Growth and Development Agenda 2017. To achieve universal health coverage and focus on primary health care, the Health Sector Medium-Term Development Plan 2014 to 2017 was developed. The government has implemented various strategies based on the Alma Ata Declaration on PHC, with Community-Based Health Planning and Services, CHIPS, being the most notable strategy adopted in 1999. JICA played a significant role in developing a standardized CHIPS mechanism in the Upper West region through two projects. The Scaling Up of CHIPS Implementation Project, from 2006 to 2011, and the Project for Improvement of Maternal and Neonatal Health Services, utilizing CHIPS system from 2011 to 2016. JICA has also helped build CHIPS compounds and provided medical and transportation equipment. To further accelerate the attainment of universal health coverage through the implementation of the CHIPS policy, the government of Ghana requested JICA to implement a technical cooperation project called Strengthening Community-Based Health Services, focusing on the life course approach in the Upper West, Upper East, and Northern regions, also known as the CHIPS for Life project. The project leveraged JICA's 10-year experience in the Upper West region to strengthen the health system in the three traditional northern regions and realize the CHIPS policy. The project's activities introduced pilot measures to address emerging public health care challenges and contribute to creating a resilient health system that can meet the needs of changing demographics and disease patterns in a cost-effective way. The project director in Ghana Health Service is assumed by the Director General, whereas the project coordinator position is held by the PPMAD director. Additionally, the regional directors of health services serve as project managers, which should not be overlooked. The CHIPS for Life project comprises of 4 primary outputs, each aimed at strengthening various aspects of the community-based health planning and services. Output 1 focuses on enhancing the capacity of community health officers, CHOs, and health management teams, SDHT, DHMT, and RHMT, to plan and implement CHIPS in accordance with national standards. This will ensure that the program is executed efficiently and effectively, resulting in improved health outcomes for the community. Output 2 aims to bolster community activities related to CHIPS, thereby increasing community participation and engagement in the program. This will help to create a sense of ownership and responsibility among community members, leading to better health outcomes and sustainability of the program. Output 3 is geared towards strengthening the support of CHIPS by local governments and stakeholders. This will ensure that the program is aligned with local priorities and needs, and that resources are allocated appropriately. Finally, Output 4 addresses the life course approach and the minimum package of CHIPS services. This will ensure that the program takes into account the various stages of life, and the unique health needs that arise at each stage. Overall, these outputs are designed to enhance the effectiveness and sustainability of the CHIPS program, resulting in improved health outcomes for the communities. The activities under Output 1 are as follows: strengthening and scale up of CHIPS database. Development of a sustainable CHO training approach, i.e., pre-service and district CHO orientation. Training of CHOs, for effective health service delivery in communities.
Sala sala ye bawina
Strengthening referral system. Strengthening of integrated supportive supervision from SDHT to CHIPS. Improvement of district health quarterly review meetings. Some achievements of Output 1 are: disseminated CHIPS database to all 16 regions of the country. District CHO orientation approach developed for sustainable CHO training. Trained 1,125 CHOs through the district CHO orientation approach. Increase the number of CHOs from 587 in 2017 to 1,712 as of April 2023. Strengthen referral systems by establishing a revolving system for referral materials, i.e., registers, referral forms and feedback forms. And also developed and incorporated the monthly referral returns, MMR, into DIMS 2. Developed a checklist for integrated supportive supervision from SDHT to CHIPS and incorporated it into the national platform. Developed and disseminated reference materials for quarterly review meetings. Output 2, which was exclusively implemented in Upper West Region, aimed to enhance community participation through a series of activities which included strengthening CHAP implementation, development of CHMC training materials and building the capacity of CHMCs and CHVs.
So when the Lord get us ready, we gotta move. So when the Lord get us ready, we gotta move, yeah. Alright. Shut up. Okay. God children, God people, God children, God people.
Introduction of non-monetary incentives, NMIs, for volunteers. Achievements of Output 2. Increased number of CHIPS zones with CHAP updated from 183 in 2017 to 389 in 2023. Flip chart material developed for CHMC/CHV training. Moved number of active CHMCs from 272 in 2018 to 496 in 2023. Developed reference guide for NMI implementation. Institutionalized NMI implementation in Upper West Region. Increased number of CHIPS zones with CHAP updated, from 183 in 2017 to 389 in 2023. Output 3 focused on strengthening and scaling up of Health Integrated Annual Action Plan (HIAP) to other regions of the project. The HIAP contains a minimum list of health activities/projects agreed upon by the DA and DHMT to be supported by the DA within the year. It involves signing a Memorandum of Understanding by the DA and DHMT and witnessed by the RCC and RHMT.
Doma dengo da kunya ngwende pyanga dam doma dengo banya 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 haye doma dengo banya 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 haye doma dengo banya bayale yang kaviva kura yal mangala viva kura kevi mankoyenu mampana da suwa kuronda na kutaben amdoma kuyananga ndoma taki muna kuinji boyo kinya ba ambebela ndoma dakara kamdana yora so hadire.
Achievements of Output 3 includes strength and collaboration between DAs and DHAs in 36 districts. Joint DA-DHA planning, implementation, and monitoring of health activities in 36 districts. Output 4 pertains to the implementation of the Life Course Approach, LCA, solely in the Upper West region, with focus on determining a working definition and scope of LCA at CHIPS level in Ghana. Development of training materials, capacity building of staff on LCA, CHOs, SDHT, DHMT, post-training follow-up monitoring on LCA, supply of essential LCA logistics.
It's your who be, don't you win without a friend. It's your who be, don't you win without a sister. It's your who be, don't you win without a friend. It's your who be, never win without a brother man.
Some achievements of the output are working definition and scope of LCA determined, LCA training materials developed, manual, PPTs, health screening register, etc. 451 CHIPS zones trained and providing LCA services. Post-training follow-up monitoring conducted in 55 CHIPS zones. Supplied basic equipment to 420 CHIPS zones. 9,255 adults screened on BP, weight, height, BMI, waist circumference, RBS and HILAC as of July 2022.
Just so yen yen in be we cardian.